Well, hello there, everyone. It is Tuesday, November 30th in the year 2021. That means tomorrow's December 1st, which means it's the last month of 2021. Then it's going to be 2022. I'm going to talk a little bit about health insurance for the early retiree. Okay, and I'm not an expert on this at all. Okay, I'm not an expert at health insurance. No one is, I don't believe. No one is an expert in health insurance, I don't think. But anyway, I'm not a CPA, I'm not a financial advisor, I'm not an attorney, I'm not a health person, I'm not a doctor, I'm not a nurse, I'm not a health insurance expert. So anyway, health insurance for the early retiree. Prior to me being completely free of W-2 income, I was living in Virginia. And we'll back up just a little bit. I had health insurance through my job as a police officer for quite a while. And then my wife took a job in a factory. And when she did, we found out health insurance for her was cheaper than what it was for me, for my job. It was cheaper through her job with better coverage. Like they gave us vision, they gave us dental, and it was still much cheaper than what it was for my job as a police officer, which is sad. At law enforcement, you're serving the community and you got to pay more for health insurance with no dental, no vision, compared to someone who works in a factory while we're protecting them as their job as police officers. So, go figure it out. But it leads to the question, why is health insurance tied to jobs? Why? Answer me that, why? It shouldn't be. Health insurance should not be tied to a job. Okay? It should be available for everyone. I'm not saying the government needs to control it, but I'm saying jobs need to stay out of it too. It's just not the system is broken. Okay, I'll say that, but I'll move on. So when I looked at when I was counting down to retiring, I contacted my HR, and they said if I wanted to get back on my health insurance plan, then I could have it when I was retired. And I said, how much would that cost? And this was going back. It's counting down to 4 years ago, and it would have been, I think, about $1,100 a month then, 4 years ago, $1,100 a month. And I was like, really? That's almost my entire pension, it seems like. No, I don't want that. So then when my wife was leaving her job, just not that long ago, we finally got an answer from them on Cobra, because it took a while to get that answer. And we finally got an answer. And the Cobra price was, again, $1,400, $1,500 a month, something like that. And we're like, that's too expensive. But I was like, well, if we got to get that, we got to do what we got to do. Because you don't want to go without health insurance. Even if you're perfectly healthy, you never get sick, you never get hurt. You don't want to go without health insurance, because what if you're in that car accident? What if you fall and crack your head open? Something big happens, and medical bills are through the roof, and you go bankrupt. Because there's a big story that broke in the newspaper up where I came from, Virginia, about hospitals in Virginia, and what they were known to do if someone could not pay their bill, and they had like a big hospital bill for whatever reason, operations and whatnot, and they could not pay it, they were putting liens on houses. And I believe, don't hold me to this, but I believe they took some people's houses to pay for the bill, which is just wrong. It's just wrong. So you can't take someone's house because they're in debt for a medical bill that's just an astronomical bill of 6 figures or something. It's just wrong. So anyway, I was down here in Florida. My wife, when I found out how much the Cobra cost, I started looking around. I've been trying to look around. And I've been trying to look around back in Virginia for Florida, but it was hard for me to do. So when I was down here, I started digging around. So I found a phone number to call. So I called a number, and they told me they could not help me, but then they gave me another number of another guy. And I called him, and bingo, that was what I was looking for. Because it's called Florida Blue. I don't know if it's like the mainstream insurance in Florida, but it's called Florida Blue. And I don't have my card in here with me, an HMO, I don't remember the thing. I haven't used it yet. I've had it for a couple months, but I have not used it yet. But anyway, I got basic health insurance for the last 3 months of 2021, October, November, December. Again, I haven't used it yet. It doesn't give me medical. It doesn't give me, it doesn't give me dental, and it doesn't give me vision, but that's fine. But then just today, though, just this morning, I signed up for my plan for 2022. I got a slightly better plan for 2022. My plan for the last 3 months of 2021, it was costing me $104 a month for 2 people. October, $104, November, December, $104 each month. For the month of September, I got insurance just so I'd have catastrophic coverage through, what's that one? National General, I think it was. And it was not a lot. It was a couple $100 just for 1 month. It wasn't a lot, like $200, $300 for 1 month, which is cheaper than the Cobra, cheaper than my job's, insurance for retirees. So the plan kicks in January 1st for me. It is going to cost me something like $431 a month. I think it is $431. There's a $0 deductible, which deductible means you got to spend X number of dollars before the benefits kick in, I think. But it's a $0 deductible. You go to primary care stuff, your annual physical, you get your flu shot, whatever. It's all covered. And then you might have co-pays if you get something above and beyond. And if I get my annual physical, I'm doing good. Okay. When I had my job as a cop, it was required to get our annual physical, so I got an annual physical. So I'm overdue right now for my annual physical. So I left a message earlier today with a new doctor that I just chose kind of randomly to try to get an appointment. And they said, the message said they'll call me back in 24 to 48 hours for new patient registration. So we'll see if I get the call. But anyway, the point of all this is I have heard this from other early retirees in different states. Every state can be different because I think it all falls, don't hold me to this, I think it falls under Obamacare. And it's something through each state. They have like an exchange or something or another. Because what I'm getting is I get a credit towards my health insurance, and it's based on my income. And my income, it's a guess because it's based on taxable income. And my income's a guess. I don't know exactly how much my income will be taxable. I don't know what that number is. I know my CPA said it was for 2020, but for 2022, I don't know exactly what it'll be because as an investor, you get so many write-offs. I spoke on taxes just the other day. You get so many write-offs. So I came up with a figure, just guessing, and I'm getting a credit of something like $1,100 to $1,200 a month, which means the amount that's remaining for me to pay is like that $430 some dollars. Okay, so that says worst case scenario, if I was making big bucks and got no credit, I guess I'd be paying $1,500 a month or so, roughly. And that's what I was up here thinking it was going to cost me anyway. But this is just water, by the way. But it's working out for the better for us, I do believe. And I've talked to other early retirees out in, where's he at? Washington State, I think it is. It's a single guy. He's older than I am. He's single. But he's paying in double digits, less than $100 a month for whatever credit they got out there. He calls it Obamacare. And I've heard of other early retirees in other states talk about something similar. Like I said, every state's different. You might have to do a little digging because the general society isn't retired early. Generally speaking, for society, people work a job until they're in their 60s. Maybe there's 2 people and maybe one works a job, but everyone gets health insurance through their job. So you don't have a lot of folks like us. We're out there, okay? I'm not in my 60s, I'm in my 50s. We're out there, but it doesn't mean you're going to know somebody. You might know me, but whatever state you're in, do a little digging. Health insurance is changing constantly, it seems like. So if you're not going to retire for 5 years, it'll be different in 5 years than it is now. But try to look around. Think about what state you're going to retire in. I'm in Florida, so you can always reach out to me if you're planning to live in Florida, and I can tell you who to contact here that I contacted. Maybe it's just for my corner of the state, I don't know. But if you're in a different part of Florida's a big state. If you're somewhere different, odds are he can give a phone number for someone in a different part of the state. So don't let health insurance be a major concern for you if you want to retire early. If you're doing it, planning for today, I would say plan for $1,500 a month and then adjust your investments so you can afford $1,500 a month. And hopefully you'll be pleasantly surprised and you will pay $500 a month, $400 a month, $100 a month, $50 a month, something cheaper, okay? So health insurance is a confusing world out there. Doctors are confused by health insurance, nurses, the billing folks, because there's so many different plans and so on and so on. But it's a concern. We all need it. And that's why I'm not going to get political here or anything. But my humble opinion, we need a national health insurance plan. Yes, I know I don't want the government running it, but how else are you going to do it? You can't have a private company running it because they want to. Greed sets in. They want to make a profit. So we got to, as a society, we got to figure out. We got to separate health insurance from the job. How do we get health insurance for the masses? I can't answer that question. I have my ideas, but I can't answer that question. I'm talking about health insurance for the early retiree. All right. So I know I might not have answered your questions because I'm not an expert on it. If you're planning to relocate to Florida or if you live in Florida, reach out to me. My email is always in the description. Reach out and I'll share with you who my contact is so you can look at check on a price for yourself. If you're in a different state, look up like healthinsurance.gov, I think is what it is, and dig around check your state and see what it tells you. Okay? All right, good enough. Okay. Stay safe, keep smiling, keep loving life, and Mazske is signing out.